Good morning, Luzon, Visayas, and Mindanao. I am Christian Angelo Leonor, your anchor on SNN News. Bring you the best of all your health news. And for today, on February 12, 2021, I bring to you the excites for this week. For the headlines, President Rodrigo Roa Duterte, kalahating tulog. Can frustration lead to ocular myasthenia gravis? A new test was discovered by the researchers for diagnosis of the myasthenia gravis. Thymectomy, Soliris, and Rituxan drugs, a new advancement in the treatment of myasthenia gravis. Nursing care in patients with myasthenia gravis, emphasized by Silvestre. And this is SNN News. President Rodrigo Roa Duterte has a special talent. Mr. President can put half of his body to sleep, while the other can stay awake for meetings. To explain this rare yet amazing occurrence, we have here Dr. Rio Montero to give her insights on how could something such as this be possible. Dr. Montero on the line.
Thank you, Sky. What a talent our fellow student nurses would definitely keep in handy. But unfortunately, President Duterte does not have this superpower. But what Mr. President does have is what we medical professionals like to call as myasthenia gravis. So what happened to President Duterte was just that, a fatigue on his levator palpebrae muscle which holds your eyelids up. The study states that the skeletal muscle is the most affected, particularly the voluntary muscles affected by the motor nuclei of the brainstem. Ineffective neuromuscular transmission occurs due to the destruction of the nicotinic postsynaptic acetylcholine receptors by the acetylcholine receptor antibodies. This results in a decrease of strength of the muscle contractions, and with the repetition, less acetylcholine will be available, which causes the muscle to become fatigued. President Duterte has announced his diagnosis of myasthenia gravis and further explained that his grandfather had it, so that's why he has it too. But myasthenia gravis, or MG, is claimed to be unrelated to ethnicity. However, there is a higher incidence of disease among African Americans. Other risk factors includes it is more common in men and with a peak age of diagnosis between 50 and 60 years old, which President Duterte qualifies for. So next time someone accuses President Duterte on sleeping through the meetings, now you know that it was myasthenia gravis.
Actually, that's myasthenia gravis. It's a nerve malfunction.
Facebook video meme has brought attention to the myasthenia gravis disease and has caused an uproar of question. Can frustration cause myasthenia gravis? To give you the latest news, Mae Anne Legaspi, you're on SNN.
Thank you, Sky. This is Mae Anne Legaspi to debunk the Facebook video that had stirred confusions on MG theories.
Indiana ako bala sa mga tawo nga. Hindi ko gani piliton, gidya. Kung ikaman, be. Wala, hindi naman manaog. Hindi na magbalik!
An interesting question indeed, and I'm unable to give a short yes or no answer. But instead, I have here the study of Judy Kirker, the researcher of the life experience of adults experiencing myasthenia gravis. A phenomenological study revealed that ocular symptoms can occur in up to 90% of people with MG, such as ptosis. It can be unilateral or bilateral, and occurs because the extraocular muscles are weak. The viral videos seem to show that perhaps an increased movement of the ocular muscles of the lady out of her frustration has caused her eyes to fatigue. The study also mentioned that ptosis can consequently cause blurred or doubled vision. We later contacted the lady in the viral video, and she mentioned that she is not clinically diagnosed with MG, and the video was made for comedic purposes only. But to add up to your knowledge of MG, it is known that up to 40% of people with ocular myasthenia will develop generalized myasthenia. Essentially bulbar weakness can also result in facial weakness, dysarthria, and dysphagia. This has been Mae Anne Legaspi reporting.
A new test was discovered by researchers for the diagnosis of Myasthenia gravis. For the updates, Dr. Rio Montero on the line.
Currently, we have many ways to diagnose myasthenia gravis. First is your physical assessment that you can do at home. So let me show you one, the ice pack test. Now normally, patients with myasthenia gravis starts to show fatigue in the eyelid muscles, and this is one of the first signs and symptoms in assessing for myasthenia gravis. You're gonna get an ice cube from your refrigerator at home. Then get a cloth like this, cover the ice cube with this cloth, and then put it on the affected eye for 2 to 5 minutes. Remember that the positive test is the improvement of ptosis by more than 2 mm or more. Second, we have the anti-musculocytokinase antibody test. It is used to help diagnose myasthenia gravis in people with signs and symptoms associated with MG tested negative for antibody acetylcholine antibodies. But we also have tests such as electrophysiologic tests, which are relevant in patients who are seronegative for antibody testing. More commonly employed tests for myasthenia gravis are repetitive nerve stimulation and single fiber electromyography. Both the tests assess for the conduction delays in the NMJ. Another test is the single fiber electromyography. The last test is the imaging, which is the chest computed tomography or the magnetic resonance imaging or MRI.
Thymectomy, Soliris, and Rituxan drug, a new advancements in the treatment of myasthenia gravis, was clinically studied by some researchers. Live on SNN News, Mae Anne Legaspi reporting.
Thymectomy might actually benefit people with MG. Thymectomy, or the removal of the thymus gland, were previously and primarily performed when tumors were found in the thymus. Soliris approved for the treatment of refractory GMG who cannot tolerate or do not respond to the most available MG treatments. This is a great news. Rituxan is another promising drug that is emerging for the treatment of MG. In a clinical research study, it not only improved muscle strength but also delayed the disease progression or worsening. It interferes with the part of immune response responsible for inflammation. By lowering the level of B cells, a type of white blood cells, Rituxan can slow the progression of MG and reduce the need for another medications. This is Mae Anne Legaspi reporting.
Nursing care for patients with myasthenia gravis, emphasized by Silvestre. For the live report, Dr. Rio Montero reporting.
According to Linda Ann Silvestre, patients with MG should be encouraged to sit up when eating. This is to reduce the nasal regurgitation when food or fluid comes up into the nose. In her book, she emphasized to instruct patients to avoid stress, infection, fatigue, and over-the-counter medications, since it may cause respiratory failure, which is a life-threatening condition. Their vital signs, respiratory status, and ability to cough and deep breathing adequately should be monitored. If there is involvement of the respiratory muscles, it produces the most serious symptoms in myasthenia gravis, known as myasthenic crisis. Speech and swallowing ability should be monitored to avoid aspiration. It is important to instruct the patients to be careful when swallowing mixed consistency foods. Assessing muscular status is also needed, and emergency equipment at the bedside to be used if the patient may manifest severe disease progression is also a responsibility for patients with myasthenia gravis, according to Silvestre.
Your daily news for healthcare. Reliable, up-to-date, and scientifically based news. I am Angelo Leonor.
I am Dr. Marie Montero.
I am Mae Anne Legaspi.
And this is SNN, your health companion.